Welcome to this project on Clostridium difficile infections. Clostridium difficile, also known as C. difficile or C. diff, is an anaerobic gram-positive bacillus that is highly contagious, lives long on surfaces, and is potentially deadly. Clostridium difficile infection is defined as 3 or more loose stools that occur within a 24-hour time frame. C. difficile infections affect people differently depending on comorbidities such as immunosuppression, age, and previous exposure to antibiotics. Infections are diagnosed as mild, moderate, severe, or fulminant colitis. Research indicates that Clostridium difficile occurs most frequently in healthcare environments such as hospitals, long-term facilities, and nursing homes. In 2011, there were 453,000 cases of C. diff infections reported in the United States, with 29,000 lives lost. Besides the increase in morbidity and mortality that is associated with C. diff infections, it also carries a significant financial burden in which the healthcare system must absorb. Clostridium difficile infections are 5,000 times more likely to occur in a hospital setting than any other healthcare environment. Montefiore Medical Center's Wakefield campus is a short-term acute care hospital with 360 beds and is located in the Northeast Bronx in New York City. They provide health care to 1.4 million lives and partner with the community in numerous ventures through teaching, advancement, and development. In pursuit of delivering high-quality care to patients, executive nurse leaders at the Wakefield campus took a proactive stance in reducing the number of C. diff infections. The goal is to reduce the standardized infection ratio from 0.96 to 0.67 by the third quarter of 2019. Clostridium difficile has been identified as being a prominent and urgent public health concern within the healthcare environment, with 5 to 15% of adults experiencing a short-lived episode. Interestingly, 62 to 86% of adults present to hospitals without being aware they are C. diff carriers. Hospital-acquired C. diff infections are costly and can be detrimental, demanding the attention of healthcare leaders. Montefiore Medical Center is part of Montefiore Health System, which is one of New York's premier academic health systems and a recognized leader in providing exceptional quality and personalized accountable care to approximately 3 million people in communities across the Bronx, Westchester, and the Hudson Valley. With thousands of admissions yearly, Montefiore's Wakefield campus is targeting adult patients who are admitted into the emergency department diagnosed with C. diff infections. A newly formed C. diff prevention committee will investigate processes from the ED to the unit until patients are discharged home in an effort to improve care delivery, shorten length of stay, increase patient experience, and reduce the number of C. diff infections. Literature supports that hospital-acquired C. diff infections can be better managed to reduce patient suffering and deliver quality care. Subsequently, nurses are at the forefront of patient care and are major contributors to overall patient outcomes. The National Database of Nursing Quality Indicators offers a wealth of information and comprehensive insight that nurse leaders can use to monitor relationships between nursing-sensitive indicators and patient outcomes, such as hospital-acquired conditions. Educating staff with a clear definition of C. diff increases knowledge and reduces the number of misdiagnoses and waste. Research indicates that patients who receive an early diagnosis and prompt treatment have an overall positive experience and shorter length of stay. In addition, literature asserts that a multi-disciplinary approach is essential for improving patient outcomes and cushioning the organization's bottom line. In continuation of the literature review, first let's look at diagnostic testing. There are several tests that diagnose Clostridium difficile infections. 2 tests recognized as gold standards are cell cytotoxic assay and toxigenic culture. These tests take between 2 to 4 days for results to be available and require specialized training and equipment. Other available tests that produce quicker results are enzyme immunoassay, polymerase chain reaction, and glutamate dehydrogenase. The European Society of Clinical Microbiology and Infectious Diseases, in addition to 43 other studies, recommend using more than one test to correctly diagnose C. diff infections. Along with prompt diagnosis, timely treatment is also recommended. The most common treatment found in literature for Clostridium difficile infections are antibiotics such as metronidazole, vancomycin, and fidaxomicin. Fecal microbiota transplantation has seen success rates of 80 to 95% and is a treatment practice at the Wakefield campus. Other promising treatments are vaccines, probiotics, IVIG, and bioactive neutralizers such as tolomere. Another area that is highly effective in the reduction of C. diff infections is infection prevention modalities. According to the Patient Safety Network, hand hygiene is the cornerstone and most effective measure of preventing the spread of infections in hospitals and other healthcare environments. Yet with all the advancements made throughout healthcare, the lack of hygiene persists, threatening the health of our population. Florence Nightingale's environmental theory came to this conclusion decades ago, and literature review highly recommends revisiting our roots to get a better handle on this looming epidemic. The second most effective approach is a combination of hand hygiene and antibiotic stewardship. Other interventions supported by literature are patient isolation, personal protective equipment, and environmental services. Literature recommends a multidisciplinary approach to reduce hospital-acquired C. diff infections and encourages leaders to use available resources wisely to demonstrate financial stewardship. The healthcare system is seeking to partner with nurse leaders at all levels in healthcare to join forces in bringing higher quality and safer care to patients at lower cost. The American Nurses Association Scope and Standards of Practice for Nursing Administration offers 16 authoritative statements as a guide for nurse leaders to follow. The unique perspective nurse leaders possess allows them to impact performance through a host of improvement measures. As a nurse leader begins to address an area of improvement, he or she must assess the surrounding to identify the problem, concern, or trend. The thought process continues by outlining what type of outcome is desired, followed by planning, which provides structure of how to achieve and implement goals. During the planning phase, there are many behind-the-scenes activities such as coordination of teams and promoting, teaching, and educating about the health concern, which in our case is reducing Clostridium difficile infections. The nurse leader serves as a consultant as he or she guides team leaders in the project. Evaluation of progress is also vital, along with training and education which enhances constituents' performance. Being a lifelong learner is key to both performance improvement efforts and maintaining professional practice relevant. It is also a great opportunity for nurse leaders to promote higher learning and lead in an ethical manner while advocating for quality and safe healthcare delivery. When nurse leaders engage others, it fosters collaboration and infuses the work environment with teamwork, purpose, and meaning. It is also a means to align resources efficiently in a cost-conscious manner. Communication is vital in articulating a clear vision and gathering and disseminating information to various stakeholders within the organizations and externally. Developing a communication plan to interact and receive feedback from constituents must be intentional and well-defined. Creating a timeline will ensure consistency and accountability at all levels. Additionally, integrating evidence-based practice phases is optimal for acceptance of change. Hanrahan and colleagues suggest 4 phases of implementation, which I have highlighted on the next slide in yellow. They are creating awareness and interest, building knowledge and commitment, promoting action and adaptation, and pursuing integration and sustainability. This is an example of a communication plan calendar to ensure effective communication and collaboration among all stakeholders. I have highlighted the 4 phases of implementation in yellow. As with any performance improvement projects, there are economic concerns. The recent changes in reimbursement and payment models have really struck home as healthcare environments juggle the different aspects of finances and its effect on the delivery of high-quality, safe, and affordable patient care. The beginning of fiscal year 2015 brought about changes in Medicare hospital reimbursements. Hospitals ranked at the 25th percentile for poor performance in hospital-acquired condition quality measures are subject to a 1% payment deduction on all Medicare claims. This payment adjustment significantly impacts hospitals' profitability. Evaluating the processes that Wakefield has in place to diagnose, test, treat, and manage patients admitted with C. diff infections is the responsibility of nurse leaders as they strive to improve patient outcomes and maintain budgetary concerns at the forefront. As Wakefield moves forward with this initiative, nurse leaders can showcase financial stewardship through resource utilization. Practices can become outdated and non-therapeutic, but with continuous evaluation, patient care quality and outcomes can be improved. The Iowa model of evidence-based practice to promote quality care provides a framework to guide nurses in evidence-based practice, welcome new knowledge, and implement change. The Iowa model depicted on this slide is representative of Wakefield's prevention initiative for C. diff infections. This tool guides the prevention team through a series of steps to assess, identify, and evaluate current performance with evidence-based practices supported by literature. Another surefire evaluation method is performing an analysis of the initiative's strengths, weaknesses, opportunities, and threats, also known as SWOT. Matthew 25, verses 14 through 30 recounts the parable of the talents, which underscores the importance of utilizing the special gifts God has blessed us with. In this parable, God gives different talents and abilities to 3 servants. The talents each servant were given demonstrates different levels of responsibilities, opportunities, and faithfulness. Each servant was given the freedom to manage their gifts as they saw fit and were held accountable. As nurse leaders, we can apply these same principles to our daily practice as we demonstrate integrity, moral excellence, and credibility. Matthew 25, verse 21 says, "Well done, good and faithful servant. You were faithful over a few things. I will make you ruler over many things. Enter into the joy of your Lord." In conclusion, hospital-acquired Clostridium Difficile infections are an imminent epidemic requiring nursing leaders to take a proactive approach in destabilizing its transmission. As the struggle to find a viable solution continues, nurse leaders cannot stop moving forward or seeking new opportunities in getting a handle over this notorious infection. Taking a deep dive into the processes, practices, and overall stewardship of resources demonstrates the nurse leader's commitment of delivering high-quality and safe patient care while remaining cost-conscious. Articulating the organization's goals is essential in gaining buy-in at all levels. Constant and consistent communication is imperative in moving the project forward and keeping initiatives at the forefront. Integrating theory and the ANA scope and standards of practice offers structure and guidance in aligning efforts throughout the organization. Identifying the gaps in processes creates room for improvement, cost saving, and evidence-based recommendations. In the words of Kaz and Posner 2017, leadership is about relationships, credibility, passion, and conviction, and ultimately about what you do. I implore you to remember these words in pursuit of delivering exceptional patient care, and thank you for your commitment and dedication in making a difference in the lives you touch every day as a nurse leader.